Bringing a loved one home after a stroke is a significant step. Home offers a comfort that hospitals cannot match. The familiar surroundings can greatly reduce stress. This peaceful environment is very important for healing. Patients often feel more secure and relaxed at home. This sense of safety helps their mind and body recover. Family members can provide continuous loving support. This personal care is a cornerstone of effective stroke recovery, making home an ideal place to regain strength and independence slowly but surely. Transitioning from the structured setting of a hospital to home care requires careful planning. It is important to prepare the home environment. This means making it safe and accessible for the patient. Remove any clutter or obstacles that could cause falls. Ensure pathways are clear and well lit. Consider installing grab bars in the bathroom or near the bed. These small changes can make a big difference. They help the patient move around more easily and safely. A prepared home shows the patient they are supported and cared for, fostering a positive start to their recovery journey within their own space. Creating a safe space also involves thinking about the patient's specific needs. For example, if they have weakness on one side, arrange furniture accordingly. Make sure frequently used items are within easy reach. The bed should be at a comfortable height for getting in and out. Consider a bedside commode if bathroom access is difficult. It is also wise to have emergency contact numbers clearly displayed. These practical adjustments are vital for daily living. They empower the patient and reduce the risk of accidents, allowing them to focus more on their rehabilitation and less on navigating an unsafe environment. A structured daily routine is essential for stroke recovery at home. This routine provides predictability and helps the patient feel more in control. It should include set times for medication, meals, and personal care. Regular therapy sessions, whether with a professional or guided by family, are key. Don't forget to schedule periods of rest and quiet time. A consistent schedule helps rebuild normal life patterns. It supports the brain's ability to relearn and adapt. This structure also makes it easier for caregivers to manage tasks and ensure all needs are met consistently throughout the day. Proper nutrition plays a crucial role in helping the body heal after a stroke. The brain and body need good fuel to repair damage. A balanced diet provides essential vitamins and minerals. These nutrients support cell regeneration and overall strength. Eating well can also help manage other health conditions. Conditions like high blood pressure or diabetes can affect stroke recovery. Therefore, focusing on healthy food choices is very important. It is a fundamental part of the comprehensive care plan designed to support the patient's journey back to health. This focus on diet contributes significantly to their physical well-being. Many stroke patients experience difficulty swallowing, known as dysphagia. This can make eating and drinking challenging and even risky. It is important to modify food textures to ensure safety. Foods might need to be pureed, minced, or softened. A speech therapist can assess swallowing ability. They can recommend the safest food and liquid consistencies. Always ensure the patient is sitting upright during meals. Encourage them to eat slowly and take small bites. These precautions help prevent choking and aspiration, which can lead to serious lung infections, so careful attention here is paramount for safety. A healthy diet for stroke recovery should be rich in fruits, vegetables, and whole grains. Lean proteins, such as fish or chicken, are also beneficial. It is advisable to limit processed foods, salt, sugar, and unhealthy fats. These can worsen conditions like hypertension. Omega-3 fatty acids found in oily fish may support brain health. Consulting a dietitian can be very helpful. They can create a personalized meal plan. This plan will consider the patient's specific needs and preferences. Good nutrition is not just about recovery. It is about building a healthier future and reducing risks. Staying well hydrated is just as important as eating nutritious food. Dehydration can cause many problems. It can lead to confusion, constipation, and urinary tract infections. These issues can complicate recovery. Stroke patients may not always feel thirsty. Sometimes, they may have trouble drinking. It is important to offer fluids regularly throughout the day. Water is the best choice. Soups, broths, and juicy fruits also contribute to hydration. Monitor for signs of dehydration like dark urine or dry mouth. Ensuring adequate fluid intake supports all bodily functions and aids the healing process effectively. Physical therapy is a cornerstone of stroke recovery. It aims to help patients regain movement and function. After a stroke, muscles can become weak or stiff. Therapy helps to improve strength, coordination, and balance. A physical therapist will create an exercise program. This program is tailored to the patient's abilities. It is very important to follow this program consistently. Regular exercise, even if gentle, helps the brain relearn how to control the body. This process, known as neuroplasticity, is vital. It allows new pathways in the brain to form, supporting the return of lost abilities over time. Home-based exercises are a key part of the rehabilitation process. These exercises can often be simple yet effective. They might include gentle range of motion movements for arms and legs. Simple activities like sitting up, standing, or walking with support are also exercises. The therapist will teach the patient and caregivers how to do these exercises safely. Consistency is more important than intensity, especially in the early stages. Even small amounts of regular activity can lead to significant improvements. These exercises help maintain joint flexibility and muscle tone, preventing further decline and promoting gradual recovery of mobility and independence. Using assistive devices can greatly help with mobility and safety. Walkers, canes, or wheelchairs can provide support. They allow patients to move around more independently. Braces or splints might be used to support weak limbs. These aids can also help prevent falls, which are a common concern. A therapist can recommend the right devices. They will also teach the patient how to use them correctly. Proper use of these tools empowers patients. It gives them confidence to engage more in daily activities. This increased participation is crucial for both physical and mental well-being, fostering a sense of progress. Preventing complications is an important aspect of physical care. Patients who are bedridden or have limited mobility are at risk. They can develop pressure sores, also known as bed sores. Regular repositioning, at least every 2 hours, is crucial. Using special cushions or mattresses can also help. Contractures, which are stiffening of joints, can also occur. Gentle range of motion exercises help prevent these. Good skin care, including keeping the skin clean and dry, is essential. These preventative measures are vital for maintaining comfort and avoiding setbacks in the recovery journey. They ensure the patient's body remains as healthy as possible. Recovering from a stroke is not just a physical journey, it is also an emotional one. Many stroke survivors experience feelings of frustration, sadness, or anxiety. They may grieve the loss of abilities or independence. It is important to acknowledge these emotions. Providing consistent emotional support is crucial. Create a safe space for the patient to express their feelings without judgment. Listening with empathy can make a huge difference. Reassure them that these feelings are normal. This understanding helps them cope with the psychological impact of the stroke, which is a very real and significant challenge. Communication can be difficult after a stroke. Some patients may have aphasia, which affects their ability to speak or understand language. This can be very frustrating for both the patient and caregivers. Patience is key when communicating. Give the patient plenty of time to respond. Use simple language and short sentences. Nonverbal cues like gestures or pointing can also help. Writing or drawing can be alternative communication methods. Finding effective ways to communicate reduces frustration. It helps the patient stay connected and feel understood, which is vital for their emotional well-being and active participation in their recovery. Family members and caregivers play a vital role in providing emotional support. Your encouragement and positivity can be very uplifting. Celebrate small victories and progress, no matter how minor they seem. Involve the patient in decision-making as much as possible. This helps them maintain a sense of control and dignity. Consider joining a stroke support group. Connecting with others who have similar experiences can be very comforting. It provides a sense of community and shared understanding. This network of support can significantly boost morale and resilience, helping the patient navigate the long road of recovery with greater strength. Remember that recovery from a stroke is a gradual process. There will be good days and challenging days. Progress may be slow, but improvement is possible with consistent effort and support. Home-based care offers a unique opportunity to tailor the recovery environment to the patient's needs. It allows for a holistic approach that addresses physical, emotional, and social well-being. Focus on fostering hope and maintaining a positive outlook. Advances in understanding stroke and rehabilitation continue to improve outcomes. Every step forward, no matter how small, is a testament to resilience and the power of dedicated care within the comforting embrace of home.